5% of the population in most neighborhoods account for 50% of the healthcare spend. If you really go and understand a neighborhood and you go into areas where there's higher rates of instability economically, socially, repeatedly now across the country, we're finding that it's the most vulnerable folks who are the most expensive. If we're going to try to reduce the escalation of costs on medical spending on preventable chronic illnesses like asthma and hypertension and diabetes, we need to start by looking at the places in which people live, the conditions in which they're living, and the environment in which they're living in. You can't solve their problems by purely prescribing a pill that they can't afford or telling them to change something about their diet when they can't afford the cost of buying food. You need to deal with the fact they can't buy food. Right now we have a health system that's very reactive, that's very, has been historically designed to deal with reacting to illnesses when they present themselves as crises in the moment. But the majority of our health issues have to do with long-term chronic illnesses that are not just about prevention, but about ongoing management. And we need to redesign how we approach that question and how we treat people, and not to think about treating them, but helping build their capability to maintain healthier lives earlier. Locally hired coaches or community health workers are truly a unique contribution to a care team because they can build a sense of trust and rapport that a clinician could just never build. And so we certainly don't see ourselves as replacing nurses, doctors, social workers, but helping amplify their impact, serving as those eyes and ears and trust builders. You know, I think a lot of it, essentially what we do is we talk to people and we listen to them and then help problem solve their immediate, urgent, and then longer term needs.